Now we're shifting gears and looking at electrolytes. The principal extracellular fluid electrolytes are sodium and chloride. The principal intracellular fluid electrolyte is potassium. There are other significant electrolytes as well. They're calcium, magnesium, and phosphorus. Potassium is a critical electrolyte. It plays a major role in many body functions. It's critical in the conduction of nerve impulses and the excitability of muscle cells. That includes smooth muscle, skeletal muscle, and cardiac muscle. So when you think potassium, think potential problems with the muscles, including the heart. Alright, we're going to start with potassium. It's the most abundant positively charged electrolyte within the cells. 95% of the body's potassium is inside the cells, but we can't measure it easily inside the cells, so we measure it in the blood. Potassium in the blood should be 3.5 to 5 milliequivalents per liter. Potassium levels are critical to normal body function. Where do we get it? Fruit juices, fish, vegetables, poultry, meat, dairy products. If the person eats too much and their kidneys work, it's excreted through the kidneys. However, if their kidneys are impaired in any fashion, eating too much potassium can lead to possible toxicity, very high levels of potassium and toxicity reactions. Potassium is responsible for muscle contractions, transmission of nerve impulses, regulation of the heartbeat, maintenance of acid-base balance, and many other functions in the body. Why do we give it? To treat or prevent potassium depletion when dietary means are inadequate. What does that mean? We give it by IV because for whatever reason we can't get enough into them by mouth. Hypokalemia is serum levels less than 3.5 milliequivalents per liter. It can be from excessive loss rather than a poor dietary intake. We can get it from burns. Now, people who are severely burned can either have very low or very high levels of potassium, so you have to check this. Loop and thiazide diuretics can cause hypokalemia, as can vomiting and diarrhea, crash diets, and there are always other reasons for it. So what is hyperkalemia? It's potassium levels in the blood over 5.5 milliequivalents per liter. We get it by, potassium supplements. Well, that would be if the kidneys aren't working well enough to flush it out of the system. Kidneys not working well. Excessive loss from cells. Well, if it's lost from the cells, it goes into the blood next to be taken out of the blood. So that's why it would be too high. And one of the ways that can happen is from burns or trauma. Potassium-sparing diuretics can cause hyperkalemia, as can metabolic acidosis, hyperaldosteronism, and some infections. Hyperkalemia, well, again, we'll get some muscle weakness. The muscles aren't working appropriately, so they're weak. That includes the heart, so we'll get some irregularities, including ventricular fibrillation and cardiac arrest. When we think about sodium, you need to remember osmosis. Water follows salt. So the movement of water is moving in response to the salt. If you have high salt concentration, the water is going to move in to try and dilute it and to try and even out the concentration. Water follows salt. Where there's a high concentration of solute, like salt, water is going to move in to dilute it. One of sodium's major roles is the regulation of body water. Too much salt in the system, water is going to follow, and we're going to see things like edema. Sodium helps to regulate the distribution of water between the intracellular fluid and the extracellular fluid. Sodium is the most abundant positively charged electrolyte outside the cells. Normal concentrations outside cells are 135 to 145 milliequivalents per liter. And we maintain this through dietary intake of sodium chloride. Salt, fish, meats, foods flavored or preserved with salt are common sources, as well as almost all processed foods are high in sodium. Sodium is responsible for control of water distribution. That's one of its major causes, major responsibilities. You know, it maintains the fluid and electrolyte balance. It also participates in acid-base balance. Hyponatremia is the name for low sodium, and its levels below 135 milliequivalents per liter. The person may be lethargic, have stomach cramps, hypotension, vomiting, diarrhea, and seizures. Causes. Same thing as hypokalemia, but also a cause is excessive perspiration, prolonged diarrhea and vomiting, or renal disorders. Hypernatremia, too much sodium in the system. That's greater than 145 milliequivalents per liter. Symptoms, water retention, that means big-time edema and hypertension. Red, flushed skin. Dry, sticky mucous membranes. Increased thirst. Elevated temperature. Decreased urine output. The body is trying to thin out the blood. Causes. Poor renal excretion stemming from kidney malfunction. The kidney's not working, it's not getting rid of the sodium. Or dehydration and the person's just not drinking enough fluid.